Hi, this is Steph again, and I just wanted to address the syndrome I have. Um, it's considered rare. It's a neurological. Um, it's neurological and autoimmune disorder, and it's considered rare. Although I'm in question of that. I think it's probably underdiagnosed or misdiagnosed. I mean, heaven knows I was misdiagnosed for about over 5 years, close to 5.5 years. Um, uh, what I have is called complex regional pain syndrome, and it is complex and it is painful, but it's not regional. It, it typically starts with an injury, which in my case was I fell in my living room. I At the time we weren't living here; we were living in an apartment, but excuse me, I my cats would hang out in the living room because we had dogs and cats, so they would kind of hang out in the living room. They took that room over because we didn't really use it except for like Christmas Day, and my computer was in there. That's about the only time I ever went in there. But I was walking in. I had a big platter of cat food, and I had my peripheral vision, but I couldn't see down, like, right directly in front of me. And my other half had left an extension cord. He had shampooed the rug, and he left an extension cord for some reason. Uh, put the power strip up on one of our chairs, or maybe it was the other way around. And I don't quite remember, but for whatever reason, the extension cord was running diagonally up to this chair, so I didn't see it. I caught my foot in it, and down I went, and there was nothing to grab a hold of to break my fall. So I did hit pretty hard on my right knee, which I'm right-handed, so your body tends to be right-sided. So I hit harder on my right knee than the left, which is just one of those weird things that most people don't think about, but it is true that you know whatever dominant hand you have is like the whole dominant side of your body basically. But all that aside, that's frivolous information. But um, there are probably a lot of people out there that have this. In fact, just within the last few months, I've talked to two people who possibly have CRPS, and just hadn't been diagnosed. One is getting treatment, the other one is not, and I haven't had a chance to follow up with her. I don't know if she took that information to her doctor. Um, and the other one is a person I met. I contacted the American Chronic Pain Association, and they were wonderful. They sent me a whole packet of information with all kinds of resources. You can get a pen pal if you want, which I'm still debating about because I have one hand and I type with one hand. I do use voice recognition, but when I write to people, I'm old fashioned. I really like to write a handwritten letter, but it's hard because my right hand will fall asleep halfway through the letter. I have to sit there and get the blood going again, then I can continue on. But um, I got in contact with this person, and we were talking and comparing symptoms, and she actually had I forget what type of injury preceded her symptoms, but we kept talking and comparing, and I said, it really sounds like you have what I have. And I said, have you been diagnosed with that? She said, no, my doctor doesn't really know what I have, but she's treating it. And so, again, I haven't spoken with her recently, so I don't know whether she's gotten that confirmation of a diagnosis or not. But it's very similar to fibromyalgia, and there is one very renowned expert in the country. He's actually in New Jersey, and he believes that fibromyalgia and CRPS are probably one and the same, or within the same family. It's hard to tell. Fibromyalgia is basically, from my understanding, where the muscles become inflamed, which I mean obviously would be the nerves. But with complex regional pain, what happens is the glial cells inside the nerves become inflamed, and they release chemicals, which in turn inflame the actual nerve endings. And I mean, there's a lot more to it than that, but in that respect, those are the two primary differences between fibro and CRPS. But if you happen to know anyone who had an injury, it's typically a lot of people have surgery, develop it. It's very typical for fractures to cause it, and in my case, like I said, it was just a simple fall on my knee. And I really thought I had broken my kneecap, but I had to go to work. I think I had to be at work in like an hour or two, and I was never one to call off the last minute. So well, I'm just going to work with a broken knee. And when I got to work, I told them, I'm here, but I think I might have a broken kneecap. And so I worked for 6 hours, and finally it was something like out of Monty Python. And we put our stretcher back in the truck, and I was hanging onto the side of the ambulance, trying to make my way up to the cab, and it was like a Monty Python skit, and my partner's going, "You can't walk." I'm like, "I'm fine, I can walk." He's like, "You can't walk, you're hanging onto the side of the truck." I'm like, "I'm fine, He's like, "We're going in." I said, "We have 2 more hours to work on. I'm not going in." And well, we went in. So, and I had the knee x-rayed. There was no fracture, and so they referred me to an orthopedic doctor, and then the medical merry-go-round nightmare ride started. And I followed up with an orthopedic doctor, and um, he sent me for an MRI. He said, "Well, you have a meniscus tear, which the meniscus is it's a ring of cartilage that goes around your knee. It's not the cartilage in between the bones, but it's actually like a ring around your knee." And I had a tear, and he didn't really say specifically, but I was just assuming, well, maybe that's what's causing this intense pain and swelling. So I had a surgery, which in retrospect was not necessary because the meniscus is still torn. So I don't know whether he just didn't fix it or if it just tore again. I have no idea. But yeah, I went through so much. I mean, I went to doctor after doctor, and you get treated like a hypochondriac, or you're attention seeking, or whatever. You're just anything but a person with a real problem and a real illness, and it can be devastating. And unfortunately, my story is not atypical. There is a website. It's rsds.org. CRPS was formerly known as reflex sympathetic dystrophy, so therefore the RSD. And depending on who you're talking to, they may refer to it as RSD or CRPS, but one and the same. And so there's a lot of good information on that website. So after like 5.5 years, and I don't know how many orthopedic doctors who kept telling me I needed a knee replacement, and then they would say, "Well, but I'm not going to do one because you need to wait till you're in your 70s or something." And I'm 59, and this was 7 years ago, so I'm thinking, oh, I have to wait till I'm in my 70s to get some relief. And it was crazy. I mean, they just were blatantly lying to me because I don't need a knee replacement. So after 5.5 years, I finally drove 2.5 hours back to where I grew up, basically, back to my old family doctor, and she referred me to a doctor, one last orthopedic, and I thought, well, if this guy doesn't, if he just tells me the same thing, I'm just going to give up. But fortunately, he put my x-ray right up in front of my face and explained in meticulous detail why I do not need a knee replacement. And you could see very clearly good spacing. If your cartilage is good, you will have good spacing between the bone. You don't have bone on bone I was told I had bone on bone. I mean, these doctors just blatantly lied to my face. I had 3 surgeries, completely unnecessary, which may have aggravated this, made it worse. But you can't go back. I mean, that's water under the bridge. It does upset me, but all you can do is pick up and go on, go forward. But I think it's very important when you have something that's rare, or at least considered rare and underdiagnosed. Um, and I know that there are. Like I said, just within the last couple months, I've gotten acquainted with 2 people who probably have the same thing I do and have yet to be diagnosed. And I just didn't want them to go through years and years and years, like I did. With you just want to bang your head against the wall after a while because you feel like, um, this is this has just been the past year that this happened. This was from an injury, and then I had surgery, and I don't really know whether the surgery was necessary. I'm not a physician, and I try not to be suspicious of everybody, but I trusted the guy, and I thought, well, okay, if you think I need surgery, and that's that's what I ended up with. This is not from rheumatoid arthritis. I have a lot of people ask me if I have that, and I no. These are called swan neck deformities, and a lot of people do get this from rheumatoid arthritis. If your knuckle is going the other way, upwards, and then this finger kind of like that, that's called a boutonniere. Um, but there is a surgery that can fix this, and I'm hoping. I mean, they can't damage it any more than it already is, so I'm hoping maybe I can. They actually have artificial knuckle joints now, and so I'm hoping maybe they can put artificial joints in because these fingers are they're frozen. They do not bend at all. I mean, they are just stuck like that. And I was a musician and can't really play the bassoon like this. So anyway, like I said, a very good resource is rsds.org. Lots of good information on there. They also have a YouTube channel, which is RSDSA, the RSD Society of America. They have yearly conferences, and they upload various doctors and patients, physical therapists, all types of people giving lectures and upgrades in treatment, latest research, all that sorts of thing. And it's a very good resource, but I had reached out to them twice because even once I got my tentative diagnosis, then I drove all the way to New Jersey, which for me was a 5.5 hour ride one way, and it's hard for me to drive like for an hour. But I was desperate to get this diagnosis confirmed. And even though I had the diagnosis, um, it still took me up until just about a month or so ago. I finally got to a neurologist who is familiar with what I have, and at least it's a start. I lean more towards natural remedies, and in fact, I just within the past year, the doctor I was seeing, they referred me to go take yoga classes. So when I called, I didn't know this. I just was referred to this integrative pain management place, and I said, well, what exactly, you know, did they recommend for me? And the girl says, well, we have classes to help you deal with your pain differently. And I said, well, different from what? I said, I've been dealing with pain for 7 years. I haven't had any treatment. So what are you going to do? Teach me to do what differently? And then I said, anything else? And she said, yeah, they want you to take yoga. And I said, oh, do you have the one-handed, one-legged type? Because I can't put any pressure on this hand, and I am once I get on the floor, I can get up. But it's pretty interesting to watch how I do it because I have to sort of roll around onto my belly and then grab hold of something and get one leg on the foot, and one foot on the ground, and kind of push myself up into upside down V and then walk myself back or walk my feet forward, and it's kind of funny to watch. It's pretty interesting, but I can do it. I have a lot of fortitude. So I figure, if I ever fall and no one's around to help me up, I have to get myself up. So I figured out how to do it. But I thought, yeah, I can just see me doing yoga. Um, but if you know anyone who sustains an injury of any sort, it can be something as simple as a needle stick. Like if someone goes to get blood drawn or they have to have an IV for something, whatever, it could be something as minor as putting a needle in your arm. And um, like I said, most doctors have no clue what this is. I've never heard of it. And unfortunately, even though I kept telling doctors, I'm like, there's a website you can go to. And if you click even just where it says treatment, there's like a paragraph. And you can read that and it'll tell you what treatments are. They won't even do that. It's like they can't put their egos aside long enough, or they can't admit, like, well, I don't know anything about this, or I don't know what it is, but if you know anyone who has an injury that's not healing, in my case, it was my knee initially, and it was very swollen, and it still is, and it would turn like purple. It's always very cold. Those are kind of the hallmark signs if you're where the injury was. If it gets very warm or very cold, if it turns colors, pink, purple, whatever, red, swelling. Um, and you get very sensitive to touch. Either light touch is extremely painful, or in my case, light touch is just a sort of a creepy crawly, like someone screeching chalk or their fingernails down a chalkboard. Um, it's just a really peculiar feeling, and it's not very easy to describe. But if you know anyone like that, please tell them to look up that website or go to the American Chronic Pain Association website and or the RSDSA YouTube channel, or you can have them come to my channel, leave a comment. I'd be more than happy to get in touch with someone and help them out any way I can, because if I can save someone the 7 years of misery that I went through trying to get someone to listen to me and not be so patronizing and treat me like I was crazy, or I was just looking for attention, or I was a hypochondriac, what have you. And it's amazing that people would treat you like that when you have obvious swelling or color changes. You have tangible things, and they refuse to even look. Would have been very simple for someone to have me roll up my pant leg, or get in a gown or whatever, and look at my knee. You can clearly see that it's swollen. If they touch it, they can clearly feel that it's cold. If it happens to be turning happy little colors, they can see that. And of course, now that this has happened, this is kind of hard to say, oh well, that's not a problem, because that's definitely a problem. So I see I'm going about 18 minutes. I meant to make this about 7 or 10 minutes. I apologize, but it's something I'm very passionate about, obviously, because it's something I'm living with and have lived with and will live with the rest of my life. Hopefully not to this degree. I'm trying every natural remedy out there that I can find, and there's probably things I haven't heard of yet. It's very hard to research natural medicine. I'm sure I don't have to tell people about certain things getting buried on the internet, and you have to dig and dig and dig, depending on what you're trying to research to find good information. But when I do research, I will read absolutely everything, and I will kind of come to my own conclusions. If I keep seeing the same things being repeated over and over and over, I tend to think that that's probably something that'll work, and I'll try it. But I just want to reach out to other people that might be suffering with something, even if it's not complex regional pain syndrome, even if it's something, you know, relatively rare or not well known, or if they're struggling, um, I would love to reach out to those people or have them reach out to me via, the comments or my email or whatever. Again, my email being swgemtp006612@gmail.com, and be willing to help anybody out with medical issues. Feel very strongly about that. So thanks again, and I will see you guys soon.